Dr. Dan Chonde, he demonstrates humility, diligence, and bravery in the work he's doing to merge health equity with art to co-create better health experiences. His work is an absolute inspiration, and I'm so happy that he gets to share it with you today. So please welcome Dr. Dan.
Thanks, Amy and Mad Pow folks. Like Amy said, my name is Dan Chonde, and this is my talk, You Are the Future of Health Equity. So I'm a radiology resident, which is a doctor at Mass General Hospital. I'm a Black guy from Michigan. I've been in Boston since 2003, love the people of Massachusetts, and I'm interested in novel ways of addressing health equity. So in this talk, the question becomes, why did I call it You Are the Future of Health Equity? Well, because I'm not that great at what I do, but you are much better. So I want you to work with me. You have these amazing skills, and one of my talents as a health equity person is convincing other people it's worth their time and interest to actually do this kind of health equity work and find projects that align with their goals. So let's collaborate. So as a radiology resident at Mass General, I've listed some of our radiology outpatient clinics. This is where patients go to get their imaging done. So these are the spaces that I really have some kind of control over. One I think about a lot is Chelsea. Our imaging center in Chelsea covers Everett and Revere, but also a lot more of Massachusetts than you'd imagine. So we have this rideshare program where we gave 1% of our patients who qualified Uber credits essentially, and this is where they were coming from. So there's a huge array of people that come to these small outpatient imaging centers. Now, I give talks on diversity, equity, and inclusion and kind of tips to make DEI groups in hospitals successful. And the second thing that I always tell people, besides figure out what your problem you want to address, is you need to find collaborators. Collaborators bring outside expertise, and that's vital to the success of any equity movement. So, problems facing equity and inclusion groups in hospitals and community settings. Of course, you have your competing priorities of diversifying your workforce and reducing health disparities, and you're dealing with limited resources. But the most important thing is the people doing the work don't have this wide array of technology, engineering, business, design skills. So we rely on people like yourselves to get involved and really amplify the work that we do. So in this talk, I'm going to be talking about equality and equity a lot. And this is just a nice graphic from the Robert Wood Johnson Institute, which kind of describes the differences. Equality is giving the same thing to everyone. And that doesn't necessarily benefit everyone the same way. However, equity is simply understanding that different people need different things and bringing those things to those people. So let's talk about Chelsea again. Now, if we look at the Hispanic population fraction by zip code, we'll see that dark blue green area, that's Chelsea. And here I call it Hispanic or Latin A. Latin A means Latinx, the discussion for another time. But now let's look at something else, median income. Here red is lower. We see that this area also has a lower income. We see this area also has overcrowding conditions. So the people in this area have less income and they're living in overcrowded conditions. If for some reason there was to be some, viral illness that ravaged the world, that would be pretty problematic. Here's what COVID looked like in the beginning once we had that severe outbreak. A vast majority of our patients were coming from Chelsea, Everett, and Revere. At its peak, 1 in 3 patients in our intensive care units, they were Hispanic or Latin A. 1 in 4 of those patients had limited English proficiency. We launched a number of different interventions to address this, like a Spanish language care team, but that really wasn't enough. We need to be thinking ahead of the problem. And to make things more complicated, many of these patients passed through that outpatient imaging center in Chelsea. So we have predominantly white, predominantly English-speaking staff in radiology at these outpatient sites. which leads to a number of language discordant interactions. That means our patients speak different languages than our providers. So what does this lead to? Well, it leads to a lot of issues. The two biggest issues, you're going to have an increased demand for interpreters, and that's going to lead to decreased workflow, fewer patients are able to be seen, delays in diagnosis. This is only amplified by the fact that interpreters were also getting sick, and interpreters were also pulled to other sites to focus on more severe patients who are actually in the hospital. If I have to approach you with an interpreter, there's one of two ways I'm going to do it as a doctor. One, I'm going to bring this big blue ugly phone from the 1970s. You're going to hold a headset, I'm going to hold a headset, and then I'm going to dial the interpreter, and we're both going to hear very staticky interpreter on the other line. Alternatively, and this is kind of like the more advanced solution, someone mounted a conference speaker phone on a pole, and I'm going to drag that around with you. The problem is both of these things have to be connected to a phone jack. So I'm only allowed to carry that interpreter with me as far as that phone jack cable goes, and then we're out of luck. So we're thinking about chest x-rays, right? Because I'm a radiologist, I deal with x-rays. Really, the only things I need to communicate to you to be successful are instructions. I need to tell you, take a deep breath and hold it. I really hope after that I can tell you to breathe normally, otherwise you're going to pass out on me. And then finally, turn and put your left side against the board. These are going to give me the high quality images we need to figure out whether or not that's COVID or that's a normal looking lung and it's just some common cold. We partnered with this group, the Mesh Incubator. They're a group of engineers and tech savvy innovation folks. And we built an artificial intelligence tool at radtranslate.com. It's a free web tool, open to everyone, works on any device. I mean, maybe you could run it on your toaster, I don't know. But it allows you to provide audio instructions to patients with limited English proficiency. You simply go to the website, click the button for the language, click the exam, and then you have all these options, and it runs the technologist or the person taking the image through a series of instructions that they just press the button and it provides the instruction to the patient. Now, we launched this at Chelsea. We had 100% adoption among radiology staff. It reduced the variability and length of our appointment because we were able to do the translation right there and give them the instructions. 100% of the users agreed, it reduced delays, and it made their job easier. And that's the important thing, right? When we're talking about burnout, if you feel like your job is easier, that's great. And now we're expanding it to COVID vaccinations and other procedural-based specialties. Now, I want you all to go to RadTranslate when you get a chance, look at it, and tell yourself, how could you make this better? Because I'm sure you can as user experience folks. And we want to work with you and figure out, what does that look like? What does the next generation look like? Now, here's another project which is super dear to my heart. This is called the People's Heart. It stands for Health, Equity, and Art. And it's really looking at the intersection of art, empathy, and equity. So art in our clinical spaces really come in three flavors. We have our really nice centers. This is our Mass General Cancer Center. They have a special program called Illuminations where they curate art on the walls. And so all of these sites have finely curated art which rotates. Now, granted, the art is maybe from a Eurocentric colonialist aesthetic, but at least it's art, right? So this is one option. Then we go to our mid-range option, and this would be like when you go to your typical outpatient imaging center or hospital waiting room, you're going to see something like this. It's abstract, it's kind of like Muzak, you know, that elevator music. It doesn't do anything for anyone. It just serves to exist on the wall. Boring. But it's there. I think it's a wasted opportunity, right? But at least it's better than our third option, which is some of our clinical spaces, which looks like this. This is actually our imaging site at Chelsea Healthcare, or I should say it was our imaging site at Chelsea Healthcare. There's essentially nothing on the wall. There's no color, there's no joy, there's no distraction. And you know, thinking about COVID in our sights and the fact that we had so many more people coming in, and this was a very kind of scary time for them, both because they were interacting with the healthcare system, but also because they were sick. It got me thinking, could we use art as a tool to promote health equity? Can I convince people to come to healthcare centers because of art? Can I make our healthcare centers maybe more of, I don't know, like a museum or one of those murals on the wall that have angel wings that everyone's lining up to take an Instagram photo with? I mean, if you bring someone close to a community health center, a community health worker is going to talk their ear off about anything related to health. So, can I bring people to health centers with art? So here's the way we kind of look at it. We think about art and health, and we think about art and identity as like two separate things. Now we look at the intersection of health and art, and we think about the health benefits of art. This work has been pioneered by Chelsea and Westminster Hospital, also a group out of Florida. There are tons of health benefits to art, both in the creation of it for therapeutic reasons, but also just having art on the walls. They found that it decreases hospital stay, improves patient satisfaction, decreases blood pressure, even has an impact on maternal mortality during childbirth. Now, there's also the intersection of art and identity. And, that's just kind of core to what art is. Art is an exploration of identity. Now, of course, I could show you any number of pieces of art that really invoke this, or I could show you this picture of a crappy horse becoming a good horse. The reason I like this picture is, one, because it's funny, but two, from left to right, this thing is a horse. Two, it makes you feel some sort of way, right? And that's kind of what art does. It conveys a message. It conveys a message through its figure, through its form, and that's kind of what we're getting at. So this is just a funny example that I love. And actually, I found this is a meme, and I found the guy who made the meme. His name's Ali Badi. Okay, but in all seriousness, so we come back here and we're talking about health and art, and then art and identity is like two separate things. But when you think about it, they're really connected like this. Everything overlaps. And then you think about the intersection of health and identity, and that's where your health disparities lie. Now, I could tell you stories about all of the tremendous, like crazy, insane things working inside of a hospital that you see related to race, racism, sexism, gender biasm, heliocentrism in hospitals. I'm not going to do that. But suffice to say, we have a long way to go. And a good portion of that is we don't have enough empathy, right? We don't train empathy. Now, it's interesting because our bodies have these things called mirror neurons. They're neurons in our brain, right? And they do that monkey see, monkey do aspect of what it is to be alive. But also, these pathways get activated during empathetic responses. Now, the interesting thing is, we've also seen that art invokes these pathways. So art exercises our empathy pathways, much like going to the gym and lifting weights to rehab a muscle or to grow muscle mass increases muscle. So we can use art to exercise our empathy. And so we want to exist at this intersection between health, identity, and art, and essentially use art to create spaces. Well, I could say it this way, or I could just tell you the mission of the People's Heart. It's to reimagine our healthcare spaces through art and design so they promote health equity and better serve all of our patient populations. So, like I said, I'm bad at what I do, but you all are great. And so when I decided I wanted to do this, the first thing I had to do was find great people to help. I'm blessed to have Meg Carlton as our artistic director. She's a licensed mental health care worker and an art therapist. We have Heian Hun. and we have Alice Wang, Sid, we have Sammy, we have Susan, all these amazing people, and so many more working with us. But we always want more people. We always want fresh ideas. We always want collaborators or partners or consultants, whatever you want to call yourselves. We need your skills because we are all healthcare workers, so we only have a limited range of skills in this space. You all have so much more. So here's what we do. We essentially curate temporary art installations in our healthcare spaces, so physical installations. We put up art. We work on bringing theater experiences, concert experiences to the community. And the goal is to engage our community. So our big multi-million dollar hospital corporations send some of their profits back into the community in different spaces than just the healthcare space, and invest in these communities. And we partner with local artists and local art groups and local community groups on identifying problems that need to be addressed or highlighted. And we use our art and performance art spaces to highlight those issues. And through doing that, we expand the empathy of our workforce. We talked about that before, with mirror neurons and the fact that we can exercise empathy and we can grow it like we grow a muscle. And remember, never skip leg day. And then finally, we want to see the benefits. And this would be improved healthcare utilization of underserved communities. Now, of course, I'm at Mass General, and we started the People's Heart at Mass General, but we're not concerned so much about bringing every patient to Mass General. We don't care who cares for these patients as long as they're cared for, right? So we are working with other hospitals, other healthcare systems as well, because we just want to create a space which is more inviting to the diverse people of this world. Now, one of these sponsors that I talked about, or I mentioned that we needed, was Mad Pow, and this is one of the amazing things about these folks that I met with. Amy, and the rest of the people not named Amy, was they helped us create this virtual experience. And this allowed us to engage all of these different audiences and kind of motivate them to healthcare, motivate them to health disparities and addressing these issues. And this includes like the underserved populations, providing a new avenue for engagement with the healthcare system, even for hesitant individuals who are reticent to kind of engage with the healthcare, hospital staff, the general public, where they can learn about health disparities, learn about the groups out there and connect with them, and then patrons of the arts, because, a lot of these community groups and community artists, need philanthropy. Now, our first project was with Beyond Walls. We called this the Heart and Soul installation. We actually put up 18, I think, pieces in Chelsea. And we work with La Collaborativa, which is a group that's focused on meeting the needs of the Chelsea population. In this case, it was food insecurity during COVID. We also sponsored some free Black History Month events with local artists, BAMS Fest, The Front Porch, Hipstery. This was a chance to kind of engage, understand the Black experience. We included talkbacks with scientists, clinicians, clinical staff, and the general public, including artists. And then we put up an installation for Holi being the Festival of Spring. It happened on March 28th. It just brings joy, color, brightness, something we could all use, seeing as we're in the tail end of COVID and we've just fought through a hard winter. And this is a project that I love, and I could talk to you about this forever, but I don't have time. So talk to me offline. This is Off the Grid. It's this amazing project where a grassroots campaign of clinicians and photographers took individuals experiencing homelessness, gave them digital cameras, taught them what it means to be a fine art photographer, and then had them just image the world around them. And they collected 6,000 photographs, and now they're looking for places to display these photographs. And it really shows you about the humanity and the resilience of individuals experiencing homelessness. And that's something as clinicians we tend to lose track of sometimes. And it's also paired with these amazing quotes. So, in the last 30 seconds I have, all I want to say is, I'm a doctor, I'm a physicist by training, And I am just trying my best in this patient experience, user experience space. And the same can be said for a lot of the people I work with. And you all have these amazing abilities and skills and insights. And now is the time to integrate those into healthcare. Now is the time to approach hospitals, approach diversity groups, and say, I have this idea. I want to work with you, or I see what you're doing. We know how we can make it better. And that's the way that we're going to fix health disparities. So this is the sign you've been looking for. Thank you very much. My name's Dan Chonde. Here's where you can find me. There's my Twitter handle. These are some of the amazing groups that I've been blessed with to have help fund some of the work that we do. Thank you very much. It's for the culture.
Thank you so much, Dan. We're so honored to be supporting the important work that you're doing, and I'm sure many in the community will either reach out to you to collaborate, especially in your booth in the exhibition hall right after we close, or via the private message, or they might start something like this on their own for their organization.